Today, our topic is chest physiotherapy and postural drainage. Chest physiotherapy consists of several components: turning, postural drainage, percussion, vibration, and directed cough if needed. Postural drainage consists of using gravity to mobilize secretions with the aid of body positioning. External manipulation of the thorax may be used in conjunction with, such as percussion, vibration, and cough. The purpose of postural drainage include to improve the mobilization of bronchial secretions, the matching of ventilation and perfusion, and to normalize FRC based on the effects of gravity. The following patients will benefit from postural drainage: inability or reluctance of a patient to change body position, expectorated sputum production greater than 25 to 30 milliliters a day, cystic fibrosis, potential or presence of atelectasis, or mucus plugging. There are some hazards to postural drainage which include the following: increased intracranial pressure, hemodynamic instability, uncontrolled hypertension, hemoptysis, empyema, spinal or neck injuries, pulmonary embolism, rib fracture, or pleural effusions. To perform CPT and postural drainage, you will need a patient bed capable of being lowered and raised, the device to allow patient to be placed in Trelleborg position. The procedure for postural drainage include the following: verify physician order. Identify patient by comparing hospital and billing numbers on the armband to those on the physician's orders for therapy. Assess patient. Turn the patient's body around the longitudinal axis to promote unilateral or bilateral lung expansion and improve arterial oxygenation. Regular turning is required with the bed at varying levels of incline. Place the target lung segments superior to the carina, usually by the use of the Trelleborg position. Position should generally be held for 3 to 15 minutes or longer. Standard positions are modified as patient condition warrants. External manipulation may be applied: vibration, percussion, and cough. Assess vital signs according to department guidelines. Monitor sputum production, change in breath sounds, patient's response, changes in chest x-rays, and changes in blood gas values. Document procedure per department guidelines. The following are positions used to drain the different lung segments. Place the patient in the semi-Fowler's position to drain anterior apical segments of the right upper lobe and the left upper lobe. Place the patient upright. This will drain the posterior apical segments of the right upper lobe and the left upper lobe. Place the patient prone with her legs elevated. Turn from prone and rest on the patient's left side. This will drain the posterior segments of the right upper lobe. Place the patient in the prone position with a pillow under the abdomen to flatten the back. This will drain the superior segments of the left lower lobe and the right lower lobe. Another way to mobilize and break up secretions is by chest physiotherapy. This includes chest percussion and vibration. Chest percussion can be done manually using cupped hands positioned 3 inches from the chest, striking chest rhythmically using a waving motion from wrist to the forearm. This causes cushion of air between the chest and the hand. Percussion is done while patient is encouraged to occasionally take a deep breath in and hold. Each drainage position and percussion segment is held for 3 to 5 minutes. Vibration can be done following percussion to segments. This is done by placing one hand on the chest over the appropriate segment, and during exhalation of the patient, you exert rapid vibratory motion of hands. This concludes our project on CPT and postural drainage.